Hello, everyone. I'm Dr. Enoch Daniel of the Central Lambton Family Health Team. It's my pleasure today to introduce you to Mr. Nathan Russell, who's our Family Health Team social worker. Mr. Russell?
Hi everyone, pleasure to be here. Thanks Dr. Daniel for having me. I'm one of our two social workers here at the Family Health Team, and what we do is typically called clinical counseling.
Nathan, the difficulty, these are really difficult times. There's no doubt about it. There's no silver lining that we can see. It's just we just have to go through the storm, and it's a pretty rough storm that we're kind of heading into. For my own self, I was in the emergency department when the entire thing went down in Petrolia with respect to the diagnosis. And it certainly caused a consternation in my mind, fear, and then I had to think it through in my own self, like, how do I deal with this? And the beautiful thing was I looked to my left and I've got this wonderful team of professionals in the emergency department. And I look to my right and I've got this wonderful team, family health team with all their staff, our nurses, our frontline medical staff, fantastic, people. And it kind of gives you a little bit of, comfort to go, to know that there are people behind you, people there for you, and we're there too. But for Nathan, for a lot of people, this is a difficult time. What kind of strategies do you think, people could employ to help themselves in during this really bad, difficult time?
So I always encourage people to take time out of the day to focus on their body needs. And when it comes to body needs, I like people to focus on two different things. I always say that sleep is the number one most important thing for your mental health, because it's the only time of day that you get your brain to heal, to recharge. It's the only time that we store memories, thoughts, situations, things like that. People always ask me what's more important, quantity or quality. They're both equally important, but we all function within sort of our own optimal range of sleep. So for me, for example, I function optimally on about 6.5 to 7 hours. The second most important thing is exercise. Believe it or not, exercise plays an important role in your mental health because it's a way that we flush negative emotions, and it's also something that is emotionally regulating. And we get emotional regulation from lots of different things, but typically it's moderately paced, repetitive activity. So it can be something as simple as a 10 to 20 minute walk every day. You're getting your emotional regulation through that moderately paced, repetitive activity. And that, believe it or not, helps us feel better.
Nathan, that was wonderful, actually. We know we got to do this. We have to do this whole thing with sleep. But how do we do it? Any tips at all for us?
Yeah, so there's this wonderful thing called sleep hygiene, which we talk about a lot in our sessions with patients. And sleep hygiene the name is a little bit misleading. It doesn't have anything to do with sanitation or cleanliness, nothing to do with brushing your teeth or washing your face. Sleep hygiene is all about the structure and routines you create around sleep as a behavior. So we're uploading a information sheet on sleep hygiene to our website that I encourage everyone to take a look at. There are between 10 and 12 different recommendations on there, and it's a little bit of everything from the activities you do before sleep to how much caffeine and sugar you drink in your day to limiting screen time before sleep. And that's a really, really popular one for a lot of people. The reason that screen time can be so disruptive for your sleep is because the way that the brain is activated by watching a screen is much more so than even reading a book or doing a crossword puzzle or something like that. So sleep hygiene, I encourage everyone to check out the information sheet. There's lots of recommendations on there. And again, it has to do with the way you structure and routine sleep as a behavior. The more consistent you can be, the better.
Nathan, one of the difficulties I have is in the nighttime I get emails from so many different sources, and I'm totally guilty of this. Like I just lie down, and I'm just ruminating about all these kind of things, and I'm just struggling to really get to that place where I can actually go to sleep, because all the things that we have to do, the stress that we kind of have at this stage. What about that? Any kind of intervention for that I can do myself?
Yeah. So I really encourage people to focus on relaxation exercises, which typically always begin with deep breathing. For anyone who doesn't know about deep breathing, it's the process by which we expand our diaphragm the most. And by doing that, we get the most air into our bodies and oxygen into our lungs and blood, and just makes us feel a lot better. So deep breathing involves taking a deep breath in through your nose and a deep breath out through your mouth. Deep breath in through your nose and then out through your mouth. And when it comes to my favorite relaxation exercises, I like what's called progressive relaxation, which is where you would focus on a different muscle group in your body paired with the deep breathing. So I'll demonstrate that really quick if you'd like.
Wonderful.
With progressive relaxation, I encourage you to be laying in bed, lights off, you're comfortable. And as you begin that deep breathing in through your nose and out through your mouth, they actually call it smelling the birthday cake and blowing out the candles. So as you take that first deep breath in through your nose, you think about the muscles in your toes and what it would feel like to flex those muscles. You don't actually flex them. That's really important. You don't actually flex them. But as you breathe in, think about what it feels like to flex them. And as you breathe out through your mouth, what it feels like to relax them. And once you've done that 3 or 4 times, you move on to the muscles in your feet or your ankles. And again, 3 or 4 times. In through the nose, what it feels like to flex them. Out through the mouth, what it feels like to relax them. And then again, on to the next muscle group. I learned about this relaxation exercise when I was in grade 12 and began practicing it. It's a skill like anything else. The more you practice it, the better it becomes. So I always kind of joke around that I used to get to about here before I could fall asleep. Now I rarely ever make it past my knees.
Nathan, that was a really good tip. I just took a few breaths in while you were talking. I felt a lot better, you know. What about other needs? You know, people have just such a pressure cooker situation. What about their emotional needs?
Yeah, that's another thing that I definitely encourage people to focus on. When it comes to your emotional needs, we get a lot of that through connection, and this is a bit of a weird time because we're not able to connect face to face, but we're still doing lots of things, and we live in this wonderful time where we can connect even though it's not face to face. So when it comes to meeting your emotional needs, I really, really encourage you to reach out to other people. Talk about the way that you're feeling, the way that you're thinking. You might be surprised if you're a little bit hesitant when you reach out, how many people feel and think the same way as you do. This is a shared experience and we're all in this together. And I think that connectivity really, really helps people. Something else that really helps meet your emotional needs are activities like journaling. So we're going to be uploading some resources on our website as well around journaling and the way that can help people. And the reason journaling is often beneficial is because it makes us more reflective about our own lives. And the more reflective we are, the more we gain a sense of objectivity versus the subjectivity that we kind of see the world through. And that different perspective helps us shape the world in a different way, and it helps us process our thoughts and feelings differently.
Please check in our website again to see part 2 of this series.